Hi everybody, Deb here again. I believe we're on day 4 of EULAR. I did watch 2 different parts of an abstract, and the abstract was called Rheumatoid Arthritis, a focus on pain and prognosis. And there were 2 sessions in there that I picked that I think related to what we're interested in the most. The first one was called Direct and Indirect Effects of Renvoke and Humira on Pain in RA. So the background was they focused on that pain is one of the main issues that are impacting quality of life in patients with RA, and rapid and unsustained pain control is very important to the goals for patients with RA, as well as the control of inflammation does not always eliminate pain, and that can have a lot of reasons. So these are the points of this study and how they measured their data over time was they looked at the 2 labs, which is the ESR as well as the CRP. And they also looked at the swollen joint count when they were measuring the research on this. I'm gonna keep hopping back between 2 pieces of paper. Both in the Rinvoq and the Humira, it resulted in rapid and significant improvements in pain as early as week 2 in patients with RA. They talked about some different effects that both of these medications that they looked at assessing the improvement in the inflammatory markers and seeing where these patients had improvement in weeks 2, 12, and 26 of the study. They did notice that the direct effect of the treatment on pain was definitely improvement in pain, and they also said it was up to 2 times greater with Renvoke versus the use of Humira. So they said the results of this study suggest that the Renvoke may be more effective in controlling pain versus Humira in patients with RA. And it may be due to either inflammatory or non-inflammatory mechanisms. So they're not quite sure. So that was interesting. The second study that I looked at was the association between patient-reported pain and achieving remission or low disease activity at 3 months. Again, those swollen joint counts would be much less and achieving remissions being little to no pain. And the study was called RA-BBE-REAL study. And the medication that they were looking at was baricitinib, and that is the generic, or not the generic, the name that we would know it more by is, and I'm not good at this word either, sorry, it's Oluminant, which is a JAK inhibitor. And it's used for RA as well as atopic dermatitis, alopecia, COVID-19 in the United States, as well as JIA, juvenile idiopathic arthritis. And the RA-BREAL study was a 3-year study. It was multinational, and it focused on adult patients with RA starting the baricitinib or any DMARD for the first time. Some were biologic naive, meaning they had never had biologics before, and some being biologic experienced. The outcomes of this study were interesting, as always. They said that the analysis suggested an association between the achievement of pain improvement and that of the remission low disease activity part. Among those that achieved remission and low disease activity at 3 months were patients that were treated with the baricitinib, which is a JAK inhibitor. Besides having longer disease duration and higher number of people that previously were on DMARDs and other biologic. Almost half of the patients who achieved the remission low disease activity and who had baricitinib treatment achieved greater than 70% pain relief. That's amazing. In patients who achieved remission and low disease activity at 3 months also had a large reduction in reported pain, and who found patients that also had the baricitinib and versus the TNF inhibitors and some of the other DMARD medications alone. So pretty good conclusions on that. And I'm not familiar with this particular JAK inhibitor, but again, this goes a long way. So those were just 2 little abstracts that I did listen in on today and thought that maybe some of the information might be useful to you. Have a good day and talk to you soon.